Richmond,
Here.
Miss Simpson,
Here.
Miss Cash,
Here.
Dr. Zollett,
Here.
Miss Lawling,
Here.
Mr. Bunnell,
I'm here.
Miss Miller.
Here.
Motion to excuse absent.
So moved. Second.
All in favor?
She says she's on her way, but
She's on. Citizens' comments? Moving right along. Minutes? Approval of minutes? Everybody approve?
So moved to. Second.
All in favor? And the financial report.
and before you, that is the full financial report. Yay!
Right.
Yes.
Looks nice.
And so, yeah, and so you have in front of you revenue and expenses. What we usually try to look at is towards the, in June, we should be halfway through our budget. And it looks like we are right on schedule. Our budget sometimes fluctuates a little bit because grants will come in, you know what I mean? And so it's not like where we have standard revenue that we're expecting, so we'll have grants. But I usually like to look at the revenue report, and where we've collected, and the expense report. I look at the bottom numbers, and out of, it looks like $1 million budget, we're at 6.4. I'm trying to look in the back page.
640.
Yeah, 646. And so, just had the finance department look at this. And the only other note of the financial report is right now we're preparing, or getting ready to prepare our budgets for 2025. So we're trying to get all of our revenue in place to put in the slots to see where we need to, increase or decrease our budget. But the finance department is, working on all those numbers. We usually start working on the budget in June, just looking at what we're gonna project out, and then starting in July, we'll do any, pay and benefit ordinance changes. That's like raises, positions, those kind of things. And then August, they start talking to, you know, the council about the budget. Then they pass it in December or whatever, but they kind of arrange things there, so to be continued. I don't think there's anything in the budget. I know they're looking at adding positions throughout the organization. And, we'll talk about this a little later, but we'll probably have one increase to our budget, hopefully, if we can. We have a resignation for, Sarah. Yeah, for Sarah. And so, the reason why the budget may increase would be if we could find an actual sanitarian, a registered sanitarian versus a sanitarian in training. So just to refresh everyone's memory, Carla is working now with Sarah and Brandy, and they're both sanitarians in training or environmental health specialists in training. Sarah had been with us 2 years. She told Carla and I that she is going back to nursing school, so we may see her in the future. But, yeah, nursing school, but she's gonna stay around for the summer and help us out. I think she's not leaving until July 5th or something like that. So she's gonna hit it hard and help with some of the other. But, during the time we were hiring Brandy, we had some other fillers that said, oh, I might be interested, and they're already sanitarians. If that were to happen and we're blessed to get that, then Carla she or he'll still have to be trained, but he'll be already a registered sanitarian, and that range is a little higher than Sarah's. So I'll tell you all about that probably by the next meeting we'll know something there. We may be being able to get an appointment there, but it was just posted, the job was just posted, I think today. Didn't she say she was gonna try to do it today? So, that position. So that is the financial report. That's the new report in full. Yeah, in front of you. Thank you. So I don't know if anybody had any questions. And Honorable Jeff Bunnell has been doing a great job, like you read the honorable.
Do we have a motion to approve the financial report?
So moved.
Thanks.
Second.
All in favor?
Aye.
Opposed?
next item on the agenda is our education presentation, and that's going to Dr. Goodwin.
Okay, good morning. So, June is Cataract Awareness Month. So we're gonna talk about cataracts today. I'm sure everyone here knows people or parents or family members who've had surgery. So we'll kind of go over a little bit. Cataracts are, the lens of the eye is what sits just behind the iris, which is the colored part of the eye, the ring of the eye that's colored, and covers over the pupil, that is the opening in the center of the eye. The purpose of the lens is to focus the light coming into the eyeball and have it hit the back of the eye, the retina, in exactly the right way that gives you a clear, sharp image of whatever you're looking at. As we get older, the proteins inside that lens start to kind of break down and congeal into a cloudy mixture. Picture on the right kind of gives a very distinct, very significant cataract there that's it's hard to miss. The cataract develops slowly over time, so oftentimes people will have a quote-unquote cataract, but it really hasn't impacted their vision very much. They really don't know any real problems. Maybe they start having a little bit of issue with driving at night or needing a little bit more light when they're reading menus in a restaurant or something like that, but it's not a sudden all-at-once thing. There are considered 4 types of cataracts, mostly just about the location of where they form on the lens or in the lens. There's no real consequence to how it develops or why it develops. It's pretty much anatomical. So nuclear ones are in the center, cortical ones are on the outer edge, kind of creating more of a donut of blurriness. Posterior cataracts obviously develop in the back of the lens. Congenital cataracts are the ones that are a little bit unique in that they are often familial. Young children develop them and are treated at much younger ages. So symptoms, as we talked about, if you can imagine your eyeglasses, for example, having this clouded coating over the top of it, you're gonna get a clouded, blurred, or dim vision. Night vision becomes a real problem. You need more light, you have more trouble walking outside because again, everything's just a little bit more fuzzy. You actually get a sensitivity to light, particularly the classic one is the headlights oncoming in traffic. It's difficult for more mature individuals who are beginning to have trouble with cataracts to drive at night. The need for the brighter light, so they're reading, doing things in the evening, they find that they're needing a brighter light on to be able to see what they're doing. The halos are when they do look at lights, like the headlights or even lights in their home, they get kind of a ring around it from the effect of the diffusion of the light rather than focusing into one point. They lose kind of the brightness and crispness of colors, so you get kind of a faded, even a yellowing. My example pictures to the right are kind of cut off there, I apologize. But they're just not as vibrant and as bright. You can actually get kind of a fuzziness that almost bleeds into a double vision, kind of a ghost vision they call it, where you get a second image of the person you're looking at. The other one that is a hallmark sign is patients who come in and frequently changing their prescription on their glasses or their contacts, and they don't understand why. So risk factors, number 1 is age. We're all gonna get them. That's the good news. So as we get older, we're much more at risk. Family history, of course, goes back to the congenital ones in particular. Sun exposure is probably the biggest one of the biggest ones that we can actually have an impact on. So wearing sun, I'll get into that later, but sun exposure damages the proteins in the lens and accelerates the development of cataracts. Injury or surgery. You get repeated trauma or injury to the eye, you've had prior surgery to the eye. Radiation, to pretty much anything above the chest, could have an impact on the proteins in the lens. Certain illnesses, the biggest one being diabetes, uncontrolled sugars, again have an impact on that. Certain medications that we prescribe, the biggest one here is steroids, prednisone, oftentimes used for a lot of inflammatory disorders, can accelerate the breakdown of the proteins. Excessive alcohol consumption, and of course, seems to be a recurring theme month after month is obesity. So prevention, what can we do to reduce? We can't really reduce the risk of getting it because we're probably all going to get it, but you can delay the onset. Number 1 thing is wearing sunglasses. anytime you're out in bright light, bright sunlight, you know, wearing a wide brimmed hat, wearing sunglasses, trying to prevent any of those UV rays hitting that lens. Quitting smoking if you're a smoker, obviously is gonna have a big impact. Working on our weight, eating healthy. If you have diabetes, working to control that sugar, keeping them in normal ranges, reducing your alcohol consumption, and avoiding injury to the eye. Treatment, and the first thing is management. So again, most people, when they start to recognize a problem, it's still pretty mild. You can do a lot of things to improve your quality of life without having to rush off to treatment. So improving lighting in your home. A lot of senior patients start to stop driving at night. Shoot, I just blanked on what I was saying. But so there are ways to kind of get around. Oh, wearing glasses. Some you can go to a magnifying glass so they can read better. Just ways to kind of cope with the development of the lens problem is first and foremost. And particularly Medicare requires a cataract to be so significant before they'll pay for treatment. It's of course the ultimate treatment is going to be surgery. It's probably one of the, if not the most common surgery in the United States. They can actually go in and replace the lens with an artificial lens that is amazing in its outcomes. It takes about 5 minutes. It's a very quick procedure and is truly amazing on the change in vision when someone has it done. Particularly when they've let the cataract grow quite a while and it's gotten probably worse than it should be. It's dramatic when your patients don't change that. Very little downside to surgery. There's always risk, but later on, some people say, boy, I got my cataract back. Usually it's not a recurrence of the cataract because that lens is now artificial. It's the capsule that holds the lens in place that eventually can start to kind of have the same problem of a hazing and fuzzing. And again, instead of directing the light and focusing it at one point, kind of fuzzes out the light and distributes it and gets that blurry, some of the same symptoms back of that blurry vision and things. And they can go in with a laser instead this time, kind of laser out that changes to the capsule that holds the lens in place. And again, pretty amazing in its results in correcting the visual changes. So, you know, trying to reduce the onset, or push the onset out is probably the biggest thing. But then kind of hitting that sweet spot of too many patients I see at least wait too long. Everybody's a little bit nervous about doing anything to their eyes, but that impact can affect their independence in their driving. They try to stay home more. Can affect their risk of falling if they can't see very well and tripping on things. So not letting it get too bad, but not doing it too early is kind of the key to the real treatment of surgery. That's my presentation. Any questions?
You talked about young children. Is that something that we've historically always seen, or is that like an uptick now, more recently?
I don't think there's any increase in numbers of that. I think that's always been because that's, again, those are considered more genetic traits that they develop them so early.
And you also talked about the lens itself being artificial pretty much lasts, but it's the capsule that needs repair. Is there like how soon does that usually can you start seeing?
That's actually pretty infrequent.
Oh.
Because again, most of the time you're trying to delay the cataract surgery until it's bad, severe enough, but not going too far, not waiting too long. So it is pretty rare that people wind up needing a capsular or laser surgery. I didn't see any numbers on how often that is, but it's quite infrequent.
Good to know.
Isn't it, I know that you can't get the surgery until you're like 50% or further along as far as how insurance pays or something
Yeah.
like that. So is this equivalent to corrective surgery that people get? Replacing the lens, you know, when people go in to get correct their vision, the eye surgery, what is that called?
Oh, the LASIK?
Yeah, the
No,
LASIK. Is that
no.
different?
Yeah.
Two different
Yes.
things?
LASIK
Okay.
deals more with the muscles that form the shape of the eyeball.
Mhm.
This is actually replacing the lens.
Replacing the, so do they, cause I know people that get cataract surgery do not leave their glasses in. So what's going on there?
You're supposed to not, but I had it,
So do they
and
have-
I'm wearing glasses.
So when you get the lens replaced,
Supposed to
Medicare
Okay,
pays for one lens.
okay.
And that lens basically you can pick whether you
Oh.
want distance or you want.
There's actually 3.
Mm.
Well,
There's
Medicare,
the
I
one
think-
that they'll pay for all of it, there's one that they'll pay for half, and they're the last one, which is supposed to be for reading and
Yes.
distance and everything, they don't pay for any.
Yes.
Ah.
So you can upgrade
It's the
yourself.
best you can have.
Yeah.
Medicare will,
I think
Medicare
it'll
pays for
make
the more
you-
basic
That's
lenses.
just so
And then if
stupid.
you want the one that really eliminates everything, both glasses needs and improves both nearsighted and
And I
farsighted, then you're
believe,
paying out of pocket.
I
Okay.
believe the one that's the third one is like 8,000
It's,
for both eyes.
yeah, it's very
Total.
expensive, very expensive.
Ah, okay. It's always
I
the,
can tell you.
it's always the caveat of, but the
Yes.
insurance will pay.
Yes.
Yeah, I got you.
So they'll pay for the procedure, but they won't pay for the lens, in
Ah,
that scenario.
Okay, okay. All right, nice to know, cause.
But I do believe, you correct me here, but I do believe you can choose, if
Yeah.
you're getting the Medicare covered one, you can choose, do I want farsighted or do I want nearsighted? And so, do you wear your glasses for distance or do you wear the readers? I mean, you can pick kind of which problem you're gonna have, but it does correct the other one.
Well, it's interesting, I had the surgery, and first I could see pretty well, and then it started getting blurry again, and in fact, I didn't, after it was all said and done, I wasn't even sure I needed it, I don't know if I got any better, anyway, you know, I went back, I said, I can't see any better now than I did before. So he says, oh, you need glasses, and I thought, well, I thought I was supposed to not wear glasses to have this. No, really, and so they said, oh, well, there's a, you know, a percentage of people, for some reason, that you have to end up wearing glasses to read, so, cause I got the middle one.
Okay, I was
You
gonna
know,
ask you if you have.
And so it turns out that here I am with I'm in the same boat that I was before I
But
had
you can
it.
drive at night, right?
Well, I could drive the night before even. So, who knows what they're doing, I mean, you know, it takes 5 minutes or 10 minutes to do the surgery, but, I don't know,
That's pretty good.
I was not that happy with it after I got it, I didn't think it was that much of, you know, I don't know how bad mine were, but
Mhm.
they tell you, oh, well, you need it, so what are you gonna say? No, I don't need it, so.
My mother-in-law was one who pushed it off too late, and I was always encouraging her to get it done, get it done. She, you know, she was having all sorts of visual problems, and she's probably one of the very few people, other than present here today, who really were very unhappy with her procedure. And she did not speak to me for probably a month afterward, because, and her honest to goodness reasoning was that she never knew how many wrinkles she had until she had her cataract done, and she was so mad that she was better living in denial of not knowing they were there than having the cataract fixed, being able to see the whole world,
was constantly
but knowing
seeing
she
things
had
in
wrinkles in
soft
her
Well,
face.
one thing that's interesting, I don't know how many people around have floaters,
Yeah.
you know?
I do.
It seems like after I had the surgery, the floaters became more pronounced than they
Huh.
were before. Now, I don't know if that's because of the lens or if just
Going in and
something,
manipulating
or-
something.
Yeah, I don't know, but it seemed like they were increased from.
It improved your sight of floaters, you could see
Yeah,
your floaters.
yeah, seriously, so it's just something to, think about when they go
Or
to do
eternal
this.
focus.
So, you know, they make it sound so simple, but it can turn out to be.
Right, I had one patient who had MRSA in it.
Oh.
Yeah, he coped with it, but he did not have a great outcome either, but most do very well.
Well, that's actually good to note, right there, with all of these things, there are side effects, there are
Oh, yeah.
consequences, it's something to keep in mind.
With everything.
Oh, yeah.
Yes, right, so, it's something to keep in mind.
And I had one who had the wrong lens put in, had to go back in and do that again, so yeah, there's,
It's
Even if-
not completely benign.
Thank you, Dr. Dunaway. Are there any other comments or questions before we move on? All right, hearing none, we'll go ahead to new business, and we'll start off with our travel authorizations, which we don't have any.
We don't.
All right. So next, under new business, is the review of the Ohio Department of Health's Healthy Housing and Lead Poisoning Surveillance System, the local administrator agreement.
This is just a, Chandra can talk about this a little more, but it's just an agreement regarding ODH and how they're doing the lead program, and I think Butler County has the actual.
So, yeah, Butler County has a grant, but, we have access to what we affectionately call the HELPS program. That gives us access to all of the lead results, blood lead test results for the children that live within Middletown. So anybody who comes up at, a certain level, I get a notification. Somebody comes up at a higher level, I get a notification, plus an inspector with ODH will come down and do a visit. But this agreement continues to allow me to have access to that system and not depend on the state to reach out to me by phone call or me having to reach out to them. Gives me full access to that system.
All right. Are there any questions regarding anything that was in here, or any other comments?
I just have a question. Does anybody know when they took lead out of town? How many years ago it is?
17.
I think it was 70.
Yeah, like,
yeah.
70,
70.
75 or 6, yeah. Right around when I was born.
Mhm.
Okay, great. So we need a motion? No? Okay. All right. So then we can go ahead and continue. The next thing we're gonna be looking at are our reports. So we will begin with our health commissioner.
Yes, just quickly, Middletown Connect is still moving. It's been an exciting grant, and you can see that in my review. I do believe that if we continue this initiative and just start really getting grassroots activities in the neighborhoods, bringing community back, bringing neighborhoods back, neighborhood watch programs back, playing in the parks back, all of that kind of activity that used to connect communities. And we lost it over the years for multiple reasons, but if we can do that again, I think it just makes it safer. And so we're gonna start leaning into those kind of messages, I guess. And so even with our community health improvement plan, the 3 health departments, I think I may have told you guys this, had just decided instead of focusing on chronic illness that they need us to focus on, which we are going to, we're gonna do it by flipping it and saying, get out and move, get out and connect, get out and garden, get out and do all the things that help with chronic illnesses. So mental health, it helps when you get out in the sunshine, walk, connecting with people, walk with a partner, that kind of stuff. And diabetes help when you're getting out activities with people. And so we're just gonna start pressing or messaging the positive messages. And so even with the city's newsletter, we have a opportunity on the back page. I do believe that's where it is now. It's gonna come out soon. But that's where it is now, Health Minute, and we'll start focusing on those kind of messages as well. So to be continued, anything that we need to talk about in the health arena should be able to be messaged through our city newsletter. That city newsletter is supposed to come out, I think, and correct me if I'm wrong, Mayor, quarterly.
Yes.
I think it's quarterly.
Is everybody familiar with the newsletter that's coming out? No? I'll just really quickly, council approved for a couple of years a newsletter. It's a quarterly newsletter, as the commissioner was saying. It's going to be 8 pages, color, glossy. It will be mailed physically to 18,000 households in the city. So basically anybody who has a water bill will be receiving this. They can choose to opt out if they don't want the paper form, and it will also be digital, but you will have that physical item. And it will be pretty much all Middletown news, all focused on the positive, what's going on here, and educational as well. And it's a pilot kind of thing. We're seeing, what works, what could work better. Let us know your feedback about what you'd like to see, that kind of thing. So the Health Minute is, I think, really integral, a very good thing for the health department. And I also wanted to mention something about Middletown Connect and what the health commissioner was talking about. We had the meeting a couple Tuesdays ago, a town hall, if you heard about the violence in Middletown. That also spurred, we're going to be having quarterly town halls in general as well. The next one's, I think, September 24th. That date could be incorrect, but it's in September. And what the health commissioner was saying is everything really is connected. We see that when we beautify neighborhoods, crime goes down. So getting those parks upgraded, making sure, having grants that go to our residents that need help, maybe painting or doing something to their homes, to keep them beautified. Bringing back that neighborhood watch, getting people out. I love those billboards that we're seeing, walking and talking. These things will all help. It's like a multifaceted approach. So this aspect is hugely important to creating more peace literate community.
Mhm. Just being on your porch.
That was huge.
Having your lights on your porch. If you're out in your yard, in your front yard, and you see kids walking down the street, because you know that usually crime doesn't happen when people are around. It tries to do it in the dark or when it's a vacant area or whatever. So just being more present. And some of the things they talked about, even with 17 Connect, not 17 Connect, 17 Strong, they talked about all the parks that's in our cities, right? Take your activities to a park and shine that park. And so if you're gonna have people over, and it's all these pocket parks or all these parks or whatever, set up your tables and everything in a park and then highlight the park. And that was interesting too, because a lot of parents say they don't wanna send their kids to a park because it might be isolated or no one's out there. But if you're doing things out there, then they can send their kids out there. So we're trying to tell people, come out the house, get to a corner park, walk to a park, and do things in a park. So hopefully those, and then they're trying to do things to the park. And I don't know, those schedules will come out. But if they can put shelters and a grill in every park, then you can kind of, instead of having people in the backyard, or you can kind of come out to the park and do that and then just clean up the park. And so, to be continued, but I do believe all these little moving parts coming together will start connecting the community a little more. And people get to know their neighbors. It was exciting when we went to Amanda. I was telling Sally this, when we went out and walked a Saturday in Amanda, people were sitting on their porch because they had told them that we would be out, and they were waving. It was a beautiful day. The area was beautiful. They had, the parts that we had walked or whatever, we always try to pick up along the way, and it was very little trash to pick up. And they came out to the end of their yards, talked to the city manager, talked to Ashley, the assistant city manager. We were all out there. The fire chief was out there, and they were talking and getting to know people or whatever. And so it was nice that we came to their area. They were excited that we came out and walked the area. So again, often, those are neighborhoods that we usually wouldn't go down unless we live there. But getting out and know that neighborhoods exist and knowing what their concerns are was very insightful. And the city manager even talked about some little things like they don't have, where we were, they didn't have sewers down there, right? So when it rains, it puddles. And he said, well, maybe we can even come and suck up some of these puddles instead of just have it standing there until it dries up. And then that can help with mosquitoes, that can help with, so just little small things that you can do to improve neighborhoods, and so to be continued. But I do really believe that you'll see that's the low-hanging fruit and the easiest thing that you can do that's really free, that you'll probably get the most bang for your buck, because you're not fixing things, you're just kind of like encouraging people to feel better. And again, last but not least, we need to encourage people to make their environments better, right? Because I always tell people, if you want the city to do everything, that means your taxes go up. That means, so you need to encourage people, well, how can I help you? Or how can I assist you? Or what can I do to help you do this? Because that way it lasts longer. It's a staying power for your initiatives. And so it's really exciting to see that. And if anybody wants to come along with us, we're gonna do surveys for that area. We're kind of tightening up the survey for the Amanda area, but we think we're gonna do it in all of the census tract areas. And I will get the dates out, but it's June 17th, which is a Monday, June 20th, which is a Thursday, and then June 22nd, which is a Saturday. We're trying to get at least 200 surveys in the Amanda, Anita area. We think it's about 1,000 homes down there. So if we can get 200, that would be a yay. And if we get 200 in the first 2 days, we won't go out Saturday. We're just trying to do that. And our meeting, I think we have a meeting right before, I do think, yeah, we have a meeting right before the first survey that comes out, so. We'll see. The survey is basically just in the neighborhoods. How do you view your health? How do you view your neighborhood? What can we do better? That kind of thing. So that we make sure that we're giving neighborhoods, individual neighborhoods, what they really want, instead of us just thinking that they need something. Last but not least, when we did our PowerPoint Middletown Connect at the state conference, it was fun. Carla came up to videotape it, but we came out with Ghostbusters, and we all had our little Ghostbuster glasses on, and everybody thought it was really cute. But Ghostbusters was a symbol of who you're gonna call. It's Middletown Connect, so that we can just leverage all of our thoughts, resources, ideas, finances, or whatever. And then Ghostbusters are busting the myths of when we think people need certain things, talk to the people first. And so it's a grassroots, a lot of the themes are grassroots, how do you know that they need this? All grants are saying, how did you reach the population, no matter what? So if we're doing a grant for seniors, we can't just automatically jump to, they can't see, they're tripping, they're falling. We're supposed to talk to the seniors to see what it is that they are in need of, right? And so just not go straight to the assumptions. And so it was a very good conference.
Yeah, and that seems to be a really strong point of Middletown Connect, is actually going to the people
Mhm.
and hearing from them. All right, well, thank you. Anything else?
I think that, Interact for Health, really excited about this project because it is an engagement project. And so they've offered to give Middletown Connect another 100,000 for 3 years. So it's 300,000 total, and sending 2 of us to Georgia for a summit, all expenses paid, everything, but it's a policy summit, so airfare, hotel, food, everything paid to do that, so.
When is that?
To be continued, August 25th, 6th, 7th, or 24th, 5th, and 6th, or something like that, last Monday, Tuesday, and Wednesday of August. They're doing a big project in Cincinnati, over the Rhine, that area, and they're trying to get a lot of community engagement with the projects that they're doing, so they're trying to package kind of what we're doing, another way to engage communities or whatever. So they want us to, they keep saying, what's your secret sauce? How do you get people to come out? How do you get people invested? And it pretty much is just the hard work of going down and listening to them, active listening, and just seeing, you know, cause you really go in there with your assumptions, and you just think you know what they need, and it's just not that, so.
Well, it seems like the active listening with the consistency.
And the consistency, absolutely.
Yeah.
And really and truly, you guys, just showing people that you really care about their health outcomes. And health is everything, right? It's financial health, mental health, physical health, psychological health. It's just everything. I mean, we heard, Mayor was there where we had to listen to a person that really was at the beginning of the Amanda conversation, and she was really upset and hurt still. And you have to hear them, you know, I don't trust you, you've told us this before, how do we trust you now?
Going back 30 years.
Yeah,
Further.
yeah. And I mean, so you have to constantly, and you have to hear that and then say, well, what can we do to make it better? So you kind of like, and so it's valid, right? I mean, it really, everything that they say is valid, so it's almost like, but anyway, it's really, it's been interesting, and like you said, consistency and staying power, because everybody changed, the leadership changed, political leadership changes, and so you just need that consistent message. That's why it's important to give them back the power to do things themselves and to keep those initiatives going, because they are the consistent, neighborhoods are the consistent, you know, piece in there, so. But that's about it, I think that's, a lot of, that, Ghostbusters, Reds Nation I already spoke, to you about, and I think that's it. Oh, and Tobacco 21, you want, yeah, the Tobacco 21, we're gonna talk, we didn't have that on the, agenda, we needed a motion for that, we should have had that on the, I think we do need that on the agenda, but a motion to resume? Yeah. Yeah, so you guys all know that the city's won. Harley, you wanna talk about that a little bit? You remember our Tobacco 21 program was paused, because we were waiting to see about the ability to move forward with our licensing, and I think everything is good to move forward. We talked to the law department yesterday, I think it was Brody that was with us yesterday instead of Ben, regarding looking at all of the policy, the law, to see if there's any concerns with us moving forward with the Tobacco 21 licensure, and he said we can move forward. And I think we have, how many, 5, help me out where we are now, 5 that hasn't
We
paid?
have a total of 70 and 5 hasn't
Has not
paid.
paid.
You guys did not refund
that.
We
We
did
did.
not refund
Right,
that.
because you were waiting for that
Right.
one. Okay.
That's correct, thank you.
Okay.
That is correct, and, I think we're just gonna move forward with the vote of, the okay with the board to move forward and send a letter to the last 5 and try to get those paid and move forward with the programming of Tobacco 21. Until further notice, but he thinks everything will be fine. He said if anything changes, it's gonna be probably 18 months to 2 years, and most other cities, everyone else is still moving forward and doing their program, so. I do think since Carla has to help me and Amanda, I think the board voted to pause the programming. And so the board will have to there has to be a motion and a second to move forward and resume. Yeah, is that
So
it?
is that
Carla,
how
did you
many
want
we
to-
have, is 70, is it?
Yeah, yeah.
That's the top of the lot? We're not gonna have more than that, or they can
Well,
now
we
do
could-
whatever,
we-
they can do whatever they want
Yeah.
now?
Mhm.
There's no cap.
We never, yeah, we didn't get the cap from, that would be the zoning and the, the city council, and we didn't get the cap.
New business,
Right.
new business,
Right.
business friendly. Places to smell.
Well, that's I think where the health board and the commission come in. It's what do healthy cities look like? That whole conversation. All right. Anything else from our health commissioner?
No, we,
Just the motion.
yeah, we'll just
Oh,
need the
okay.
motion for
Right
that.
now for that. Okay.
Yeah, do you wanna do that now? I think, yeah.
Okay, so we need a motion to resume the Tobacco 21 conversation.
So moved.
Is there a second?
Second.
Okay, having been properly moved and seconded, we will proceed to vote. Amanda, would you please go ahead and call the roll?
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bunnell?
Yes.
Ms. Miller?
Yes.
Okay, yes, let's have it.
You said to resume the conversation. We probably need to resume the licensing program. The
Oh, I see what you're
Tobacco
saying.
21 program. So that means the Tobacco 21 programming would be licensing the facilities and then going in to make sure they have the signage and the education and all that.
Misheard, I thought you
Yeah,
said you
I'm
wanted to
sorry.
resume the conversation. Do we need to go ahead and revote then?
Yes,
Okay.
or, yeah, just change that wording there, I think. You don't have to just change the wording of resume the Tobacco 21 programming.
Okay, did you want to talk about that first? Did anybody wanna have that discussion again first? Nope. Okay, so now the motion, we do need a motion to resume the Tobacco 21 program.
Yeah, there you go. Thank you.
So
do-
moved.
Yes, moved, and do we have a second?
Second.
Okay, having been properly moved and seconded, we will proceed to vote. Please go ahead and call the roll.
Thank you.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bunnell?
Yes.
Ms. Miller?
Yes.
Okay, yes, let's have it. Motion passes.
And that's it?
All right, that's it for our health commissioner. I just wanna say congratulations on the grant. Interactive for
Yeah.
Health, that's a big deal.
It is, it is.
Okay, so moving forward, from our medical director report.
Our reportable illnesses for the month of May, we had 33 chlamydia, 7 gonorrhea, we had 3 Candida auris, which is a relatively new fungal infection that is being isolated, I guess. 1 Campylobacter, 2 CPO infections, 4 hepatitis C, 1 Legionella, 1 pertussis, 2 separate strep infections, and 1 syphilis. Those are reportable illnesses.
Thank you, Dr. Dunaway. Is there anything else?
No.
All right, then we will continue to our director of nursing.
Aside from the lead contract, we will be, hopefully before the next meeting, receiving our public health emergency preparedness 2024-25 grant contract. Estimates for that one is around $22,000 to continue our preparedness planning. More to come on that next month. We're still working out all of the deliverables and expectations that will be included in the contract. Other than that, I mean, most communicable diseases are kind of leveled off for now. We are continuing to follow up with, the, multi-drug resistant, the CPO and the Candida RS, within nursing facilities to, you know, mitigate any spread amongst our high-risk populations. Other than that, it's been a relatively calm month.
All right, thank you. Anything else? All right. With that, we will go ahead and move on to our environmental health director.
Okay, we've received, 3 new plans, approved 3, and we've licensed 3 new facilities. The 3 that we've licensed are the Dollar Tree, Starvin' Marvin's, which is on Titus, and Bar Bunny, which is on Central Avenue. We've approved Broken Barrel, which is on Central, previously Bar Bunny, and Desi Squad, which is, on Route 4. We're actually just continuing with our swimming pools, because the weather's kind of crazy right now. We still have a lot of pools that aren't open, but we're continuing with those inspections. Still in the process of training Brandy, so, and I'm definitely looking forward to hopefully getting someone else that is also trained. I'm gonna miss Sarah. She was very, very good. She was with us 2 years and she did a great job, so we're gonna miss her. Other than that, just continuing with licensing, facilities we did. We were at Juneteenth this past weekend. We had about 10 vendors. 5 of those were mobiles and then there were 5 temporaries, so that was a pretty, decent sized event. Other than that, just continuing inspections, trying to, stay up on things.
All right, well, thank you very much. Okay, and that concludes our reports for today. Next, item on the agenda is just our board member open discussion. If anybody would like to bring up anything. I did wanna ask about, we had, council did go ahead to, decided not to continue or extend the moratorium on,
Marijuana.
what was it, medical?
Oh, medical.
Right, so just any thoughts on that? Did we have, are you speaking with, okay, never mind.
You know, I have to continue to say that when you don't have a lot of research out with medical drugs or anything, right? And when you think about youth, I just don't like, it seems like it's a switch in people's mind that once things become legal, it's okay. That's the only thing I get concerned about. So with children and brains that are not developed, and, you know, sometimes that's 40 for certain genders. No, I'm just teasing. Then, I mean, I get concerned about that. And so I am never, as a health professional, as a mom, as a nurse, gonna be comfortable with us legalizing things without the ability to make sure we have a lot of resources for the education part. It seems like public health always has to fight hard to clean up messes. For instance, gambling and all the rest of it. So addiction is addiction is addiction. And so I think unless we get strong policies or strong abilities to have treatment and look at addiction and look at prevention, then I think we just throw a lot of things out there that has no guardrails and it doesn't have, because I think medical marijuana probably is fine, it's probably, but I don't know. And it's my understanding, and this is for the medical doctors in the room, that they want to make things legal so that they can research it maybe. Because they said a lot of
Part of it.
marijuana is not, if it's not a legal drug type thing, just like they talk about LSD or psychedelics in the brain and different mental health things. You know, a lot of people are doing mushrooms out west because it's good for bipolar and mental health or whatever. I think that's all kind of maybe interesting in that experimental research world, but I don't know how us having a whole lot of, what do you call it, dispensaries and all of them help. I mean,
Well,
I just don't understand where the whole, that's just me, that's just my personal view.
The conversation, because it goes from medical, which I think almost everybody can admit that that's past due, but to residential, and I what you
Or
were saying.
recreational.
I'm sorry, I keep doing that.
Residential is the
Residential,
same,
well,
but
I keep saying that.
Recreational is residential.
Thank you. It could be, therefore, okay. But the part that you brought up was the education, and that even was part of the bill, right? So, but that's part of the language. The education part is very important. So that's something perhaps we as a health board could look into. And even before any of this, just talking about with the safety council and like the effects of marijuana and the effects of alcohol, people view those differently. They think, oh, it's just marijuana, it's not as bad, but that's shown, like, actually, you are under the influence. So maybe getting that educational piece out there to say, hey, just so you know, be prepared and just deal with it as you can, just like we educate people about the
I
effects of alcohol.
don't think they care. They don't care. No, this is ridiculous. They might as well let everybody, first of all, I don't know how many people smoke it, but there's tons anyway. I mean, it hasn't changed any. I mean, if you're gonna let them vape and you're gonna sell cigarettes and you're gonna do all this other stuff, what's the difference? You know, they cloak it under, oh, your health and everything. It turns out it's money. Everything's about money. I mean, it's like the gambling. I mean, they never had gambling, you know, on sports and everything. Now you can't turn on a TV show without talking about gambling. I mean, yes, you know, it's the same thing. It's all, in my opinion, it's all just BS. They don't care.
Well,
These guys, I mean, if they cared, they'd do something about it. They would not let vape, and they wouldn't let these kids smoke this stuff and all that. It's all about how many dollars, how much revenue can we get.
And
That's
all I'm saying is
basically
if it is about dollars, let's make sure that dollars are in the prevention area and the educational area as well, right? Because people may wanna make the money or whatever, and I'm not opposed to people making all the money, but make sure that you're having, on the flip side, for the vulnerable populations that are not well informed, right, as far as what they're doing. For instance, how high is high? We haven't
Well, you give them the okay to do these things, but then, on the other hand, then you gotta have all this other stuff to try and help them with their addictions and all these other, I mean, you know, instead of getting it on the front end and cutting all this stuff and what you need, they let it go, and then you have to have all the programs to help the people get out of the mess that they're in. I mean, so.
well, to your point, people are doing it, whoever wants to do it is doing it, right? So it's there. And we have the opportunity to educate, which is actually.
I am sure they
very
have,
good.
they have enough, you know, stuff that they know, and they've been doing this stuff for 20 years or 25 years. I mean, they must have data out the yin-yang on all this stuff. I mean, come on.
How long has Colorado been I mean, remember, wasn't that the first state?
20 years.
I was gonna say, wasn't that the first state that started doing?
And they're seeing a lot of negative problems.
Is
The
that
most
where
recent
Rocky
research is
Mountain
showing
High
tremendous
comes in?
problems coming out of Colorado.
Right.
Between DUIs, lung disease, adolescent use, pretty much, of the studies I've seen, all of them have been significant problems compared to prior legalization. And you guys are right, people are gonna use it no matter what, that's out there, but the more accessible it is, the more it leaches into the domains that we don't want it.
So
I mean,
that
it's gonna get easier and easier for kids to get it.
Yeah, so given that, that's.
And the same goes with gambling. You're exactly right. And it is all about money. It's all corporations who pushed all these laws and all these legalizations.
I mean, for years and years and years, I mean, I've been around gambling my whole life. I raced horses since I've been 17 years old. And you never, you know, had all this stuff. And now, every time you turn on the TV or whatever, that's all they talk about, you know, in sports. And they don't want the sport, you know, the athletes to gamble. And yet everybody's gambling supposedly except the athletes, and I'm sure they are too. So, that's just my feeling. I mean, you know, they cloak it in, oh, we wanna do good and we wanna do all this stuff, and yet they're out there pushing it. And I come back to the cigarettes and the vaping. That just drives me nuts. I mean, and I think marijuana is worse on your lungs, I think, than even cigarettes are, aren't they?
Yeah, I think that's what they're
I mean,
finding in Colorado.
I know
yes.
Dr. Vaughn told me that a long time ago. That, you know, if you're a big
There's different
marijuana.
ways to take in marijuana though.
Huh?
There's different ways to take in marijuana, you don't have to smoke it.
Well,
I'd rather not see a kid get into marijuana, but if they are, I'd rather them dip into something that was regulated.
And a lot
and
of
off the streets.
people use illegal anyway because it's cheaper. They don't
Yeah.
have to pay, you know, when you go to a place here, you have to pay taxes and this, I mean,
Yeah.
I'm one that missed the whole thing, but I know that it's cheaper, so, you know, a lot of the illegal stuff, or, I don't know if it's illegal, but whatever, is
Yeah.
still out there, you know, this isn't replacing it, it's just adding on to the pile. It's,
But as far as the health board goes, I think that's where the opportunity is, because this is happening, we have the opportunity to educate. And I know just from my childhood, going through school and being educated about issues really did help inform my decisions as an adult. And so, and what I was alluding to earlier is learning that even adults have preconceived notions about what it means to be under certain influences, educating them about actually it's not what you think it is. I think that's where we can step in and be very beneficial to the community in that way, given the reality of what we have. So
As
that's,
long as they give us money.
and that's that's a big ticket item.
Because, I mean, because usually that's the case, prevention usually doesn't get the money, right? It has to
Right.
clean up and then even the treatment areas usually don't get the money that all the people are getting all the benefits from. And then we have to go in there, we'll give you $10 to go out and talk to 100 schools about, you know what I mean? But yeah, you're right, I mean, it's gonna happen, so education is the key to do
And
that.
that's where
but-
that's where we have some say, and we can start talking about the educational piece and really, working for that end to get the funds that are needed. And I think that's the important conversation for us. Okay, is there anything else for, open discussion today? Any other items or topics? Okay, hearing none, we will go ahead and move on to executive session. We will need a motion to move into executive session for the personnel, discussion under the authority of ORC 121.22G1 to consider the appointment, employment, dismissal, discipline, promotion, demotion, or compensation of a public employee or official.
So moved.
Is there a second?
Everybody fell asleep in that.
That's a short one. Do we have a second? Oh, thank you. Having been properly moved and seconded, we will go ahead and proceed to vote. Ms. McDonald, please.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Zipsey?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
yes.
Ms. Lawling?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
All right, the yeses have it. We will now go to executive session. We will come back for, to continue the meeting and to adjourn. We will proceed to vote. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Zipsey? Ms. Okay. Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawling?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
All right, the yeses have it, so we will now adjourn the meeting at 8:51 a.m. The next Board of Health meeting is scheduled for July 9th, 2024 at 7:30 a.m. in this room. Thank you so much. Thank you.